really in the area of obesity that you've begun to see the emergence of a lot of digital health approaches. And what I thought I could do is to start by making sure we're all on the same page. Obesity is still an epidemic. There may have been some media mentions that you're seeing a plateau in rates of obesity. That's true, but we still have an obesity epidemic, and it's pretty significant. We have important disparities in obesity. So those who are in low-income circumstances, who live in rural areas, racial ethnic minorities, are disproportionately and dramatically more likely to be obese. It just so happens they also have the highest chronic disease risk owing to their obesity. They drive most of our healthcare costs in this country. They're the least likely to be treated for obesity in the primary care setting. And importantly, they have the poorest treatment outcomes when they're treated. You know, the thing that we've been working on a lot is this issue of obesity treatment disparities. It's really shocking. In the last 25, 30 years, there have been hundreds, literally hundreds, of weight loss studies conducted. And in none of those studies, save 2 or 3, have we ever seen clinically meaningful weight losses produced. These are weight losses that would be enough to move important health indicators. This is a real problem. The folks in this country who have the highest risk of obesity and who are most likely to incur chronic disease as a result of their obesity, they get the worst treatments. We really don't know how to do a good job with these groups. And so this is the area that we've been focused on for a long time. Now, there are lots of reasons for this, and I could spend the next couple of hours talking about them, but I'm just going to focus on one specific issue here. But first, I thought what I would do is to show you an example of how we treat patients optimally. So the kinds of approaches, these approaches work for people like us. They don't work for impoverished people. But generally what we ask people to do is to come in for 6 months, to meet with us weekly for about 60 to 90 minutes. You meet with a highly trained person. You get prescribed a low-calorie diet. That means a reduction of around 500 calories. We give you behavioral skills training. That means we teach you the skills that you need to change your diet and get more physically active. And we ask you to keep track of every single thing that you're eating or you're drinking and all of your physical activity all the time for 6 months. And that's how we get people to lose weight. It works extremely well, except for in impoverished folks. Now, there are lots of reasons why that approach doesn't work for people who are impoverished. But one of the biggest barriers is health literacy and numeracy. Now, this may not make a lot of sense, and we don't talk about health literacy and numeracy a lot, but really what this means is, can you make sense of the kinds of health information that you're experiencing, that you're seeing? Can you make it make sense for you? Can you understand what your doc is asking you to do? Can you do the kind of math that's required to interpret a recommendation on the back of a prescription label? Can you do these very basic things? And this is important in the area of obesity because we are asking people to constantly count. We're asking them to track everything they're eating and they're drinking. And this has gotten more easy recently because we have digital tools like these that do some of the work for you. But eventually what we want people to do in weight loss treatment is to build up to a point like this, where they can look at a plate of food and begin to break it down. So you have this plate of fish tacos, and we want our patients to look at this and say, how many calories are in the guacamole? Anybody? A lot? No, not too many at all. Not too many. Only 100 calories. What about the black beans? 50, thank you very much. I thought I was in a Duke class where nobody wants to give the wrong answer. You know. All right, it's about 275. And what about the rice? 150. What about the fish tacos? Thank you. Now we're being adventurous. They're about 200. So times 2, you get 400 calories. That equals 925. Doc has told me I should eat no more than 1,500 calories today. So that leaves me almost 600 calories left for dinner. That's what we want our patients to be able to do. And that's what they need to do to lose weight. But that requires a lot of math. And most Americans have difficulty with these kinds of tasks. And I really mean most. So 88% of Americans have impaired health literacy. Only 12% of us, probably most of us in this room, but 12% of us can do these health literacy and numeracy tasks well. The rest have extraordinary difficulty with it. 35% have significantly impaired health literacy, which means that they would have difficulty interpreting the recommendations and the directions on the back of this prescription bottle. So just imagine, it just so happens that a lot of these patients are the folks who have the most prescription bottles. They're receiving the most prescriptions because they have the most chronic diseases and they have the most difficulty interpreting these things. So this is a big problem for our country and for our health system. It's an extraordinary problem in weight loss because we're asking people to look at labels like these all the time and to do mathematics.